Helps if I unmute myself. Um, Good afternoon, everyone. Welcome to today's virtual office hours for the Upper Midwest Telehealth Resource Center. Today's presentation will be from Luke Wortley. We're going to be talking about grant writing. Just a couple of housekeeping items before we get started. Everyone is in listen only mode. You can unmute yourself and ask questions or put them in the chat. We'll hold questions until the end, and then we'll also have a survey at the end. Since we are federally funded, we always collect information to share back with our funders. Luke, are you ready to take it away? I will get my screen going here. Do you see the slides?
Yep, sure do.
Okay.
So I'm just gonna have to, you're gonna have to bear with me, everybody. I'm sorry, I'm having technical difficulties with my laptop. So Becky's gonna be running the slide deck for me. My name is Luke Wortley. My pronouns are he, him. I am the Resource Development Coordinator at the Indiana Rural Health Association, which is where the Upper Midwest Telehealth Resource Center is housed. And Resource Development Coordinator is a fancy term for being one of the primary grant writers for our team. So you can go ahead and go to the next slide for me, please. So I want to communicate the clear writing goals of any successful grant application. So number one being communicating a clear vision for change and a need for intervention or programming, not merely a means to sustain a program already in progress. Designing measurable processes. So we're talking about SMART goals used throughout your methodology, your work plan, and your logic model, and demonstrating capacity and readiness to perform. And I realize that can sometimes be difficult if you're a newer organization, but there are ways to communicate that. Next slide, please. So we here at the Indiana Rural Health Association divide up our grant application into the pre-planning phase, the planning phase, the writing phase, and the review phase. Next slide, please. The pre-planning process is sort of conducted by senior staff members who identify potential fits for grant applications, after which we will go through the notice of funding opportunity or the notice of award, or not notice of award, but request for proposals, or whatever the document is called. And then we have an internal discussion after review of those notice of funding opportunities or request for proposals to see if IRHA or whatever your organization is a fit. Next slide, please. So some important points to keep in mind that if you want to have a successful grant application, the ideal scenario is to make sure that you have potential partners already identified before you send out MOUs. And then those memoranda of understanding need to be signed and completed as soon as possible. You need to have capacity for timely writing. If you are reviewing a notice of funding opportunity or a request for proposals that's due in 2 weeks and it's an 80-page HRSA application, then you need to be able to make sure that you have the adequate personnel in place to be able to complete that application. A thorough review of the notice of funding opportunity or request for proposals is obviously required during the pre-planning process, as I've already identified. Obviously, you need to identify the project director in addition to potential partners. You need to have a good budget forecast and already have in mind the budget justification or the budget narrative, as it's called in certain applications. And you need to discuss, as I alluded to earlier, who's going to be on the writing team. And if that's maybe just you and one other person, then that's the way it is. But if you have other people who have maybe some excess capacity or people who have expertise in certain areas, then you need to identify that internally in the pre-planning process. Next slide, please. As we move out of the pre-planning process, we move into the planning phase. Next slide. Where the grant team has already been identified. Now, in our case, we are fortunate in that we have over 30 full-time employees. So we are able to identify a team lead who manages the submission process, content experts who are able to divide and conquer the actual sections of the grant narrative, as well as the budget and budget justification. The research expert, which usually tends to be me in our particular case, to write the needs assessment, and then any support staff. And then we have somebody who serves as the grant coordinator to make sure that all the T's are crossed and the I's are dotted in the submission process. Next slide, please. So as I alluded to earlier, the team lead is sort of facilitator of the process. They're the ones who create the task list, which is our sort of guiding document that outlines who's responsible for writing which sections, what dates those are going to be submitted by for review, and any other relevant information that's in direct correspondence with the notice of funding opportunity or the request for proposal. So in addition to that task list, the grant lead or the team lead assigns all of those things. They're the ones who keep track of the meetings, and they're the ones who review the entire draft at the very end for content. And they're the ones that really guide the submission process to the grant coordinator for upload. So if you have that capacity, the team lead is an invaluable part of the grant writing process. Next slide, please. So I talked about content experts, and ideally you want to be able to identify members of your organization who have some kind of expertise in different areas of the grant application. While it's good to have maybe one grant writer because you can have an overwhelmingly cohesive voice, it's good to have sections divvied up as well, because you can have a really targeted approach to either the methodology or a different section of the narrative, like barriers and challenges. You may have people who are really good at translating a work plan table into narrative. You may have other people who are really good at justifying budgets. You may have other people who are just really good support people who can make maps and stuff like that for you. So it's good to be able to identify those and divide up the responsibility accordingly. Next slide, please. So the research expert, this is kind of my bag. I'm the one who, in our team, usually writes the introduction and the needs assessment and helps out with the methodology. So a lion's share of what is usually in most requests for proposals or notice of funding opportunities known as the project narrative. So ideally you want to have somebody who is really good at justifying why the target population was selected with relevant demographic and relevant demographic data, to be able to describe the target population and why it was selected for intervention or programming in this particular proposal. You also want to be able to provide recent statistics that demonstrate the need for a specific intervention, right? Whatever your particular project is, needs to be justified with the most recent and readily available statistical data from and I like to use a funnel approach where I start at the national level, funnel down to the state level, and then to the county or community or municipal level where we're actually working. And then one of the things that I think helps our applications stand out and helps us get funded in recent years has been the use of scholarly articles, studies, other research to help justify those data tables. And then the other thing that I think you really need to be cognizant of, as many grantors and funding organizations are on the lookout for, specifically addressing the needs of underserved and underrepresented groups, and all of the intersectionality that applies to those groups. Next slide, please. So the grant coordinator I've alluded to before is a member of the staff who supports the writing process and does basically kind of keeps everybody in line in ways that the team lead does not. So they're the ones that are in charge of the little details, making sure the attachments are formatted correctly, making sure that all the file names are up to date and the versions are up to date, making sure that the page count is on track, developing in conjunction with the team lead, the timeline for submission, keeping track of letters of support, the letter of intent if your state office of rural health or other organization requires a letter of intent, keeping those memoranda of understanding in order. And then finally is in charge of the actual workspace, whatever the content management system is for uploading the submission. Next slide, please. So your mindset prior to getting pen to paper will probably be one of confusion and swimming after reading the notice of funding opportunity or the request for proposals for the first time. It's going to feel overwhelming. So my mindset prior to getting pen to paper is to start with the easiest, most accomplishable mission that I possibly can. And that usually tends to be the description of the demographics. You can find that on the Census Bureau website at the county and municipal level. You can pull all kinds of interesting demographic descriptors and just get something down. That should be your mindset, is just to get something down on the page so you can start tracking page counts and all that stuff. Next slide, please. So we talked a little bit earlier about being able to demonstrate capacity. And all of these boxes are sort of good ways in the project narrative itself to demonstrate capacity on the part of your organization. Starting by linking staff expertise to the application sections during the writing process. So if you have somebody who's really up to date on the language and practices surrounding substance use disorder or something like that, bring them into your team, have them be part of the writing process. And then the thing that I always stress more than anything, apart from the needs assessment and actually identifying the specific target population that you want to serve, is establishing the authenticity of connection between partners, communities, and populations being served. So you have to make sure that when you're demonstrating capacity, that you are proving that the partners that you have selected are going to have a demonstrable impact on the community and population that you're being served. Let's see, I'm going to skip over some of all of these in the interest of time. I realize I'm already 15 minutes in. So go ahead and go next slide, please, Becky. Thank you. So finally, we get into the actual pen to paper, the writing phase. Next slide, please. So overview of our writing process is that the writing team has already been identified, the team has been notified, the task list has been developed by the team lead, and we've already had the initial meeting. So now what? Next slide, please. So now we need to start focusing on the vision of the grant itself. We may have had that initial meeting and we've had some ideas thrown around, but now we need to start getting into the nitty-gritty of what specific changes are going to occur once resources are applied from the funding agency that we're trying to get funds from. We've talked about evidence of staff expertise. You need to make sure that you're choosing evidence-based or promising practices. And it has to be something new, right? Successful grant applications always present a new solution to an old problem, and demonstrating why it's important to the partner and community that they're going to serve. Successful outcomes and who will care, inclusive designs and voices from key stakeholders, accountability, authentic relationships at the state, regional, and local level. And then finally, successful grant applications have, from the moment that they are conceived, a sustainability portion built into the application, in the work plan, as well as the narrative itself. Next slide, please. So we've talked a lot about some of this stuff, so I'm going to go ahead and go to the next slide, please. So the notice of funding opportunity, the NOFO, the RFP, the request for proposals, whatever the guiding document is called, is sort of your Bible. And these component parts are typical of most HRSA applications, but there's some version that is associated with most grant applications. Generally speaking, you have to have a letter of intent that goes to some sort of state agency. You have to have an abstract that outlines the program itself, the program narrative, which is the bulk of the description of the project, a mission statement, an organizational summary where you prove your capacity and ability to implement the proposed project, the actual program description in the form of methodology and logic model and work plan, an evaluation component, which can include sustainability as well, a budget and a budget justification, and then any other additional attachments. Next slide, please. So we've been finding that funders are increasingly driven by mission, outcomes, and relevant use of data. That easy to understand bit, I think, speaks for itself, that most good grant writers and successful grant writers know that principle of parsimony is sort of key. Why explain something in 5 pages when you can do it in 2? Why put something in a narrative form when you can use a table, that sort of thing. But the relevant use of data is something that we've been finding more and more, is that funders want data-driven applications, they want data-driven outcomes, and they want data-driven programs. Next slide, please. So finally, you've written all of your component parts, you've assigned the relevant bits, everything on the task list has been completed. Now what do? Well, you send it back to your team lead for review. Next slide, please. So during the review process, apart from making sure that everything in that notice of funding opportunity or the request for proposal has been addressed, and has been addressed usually using the exact same language of the NOFO document, you definitely want to make sure that you're writing for an audience that's going to be able to understand the program itself from a conceptual level all the way down to the nitty-gritty of the work plan and the activities and strategies implemented. You want to make sure that it's accurate based on factual data that demonstrates a concrete need. You want it to be correct and following grammatical and technical usage. You want it to be comprehensive. And like I said earlier, you want to make sure that it hits all of the requested information from the notice of funding opportunity or the request for proposals. And I talked about concision just a couple minutes ago. And then finally, you want to make sure that it is as accessible as humanly possible, with section headings that follow the criteria outlined in the grant guidance as much as humanly possible. Next slide, please. So successful grant applications start preparing the application early. I talked about that earlier when we were talking about it being a timely submission process. Follow the NOFO instructions carefully. Keep the audience in mind. We've talked about that. We've talked about concision. We've talked about organization. This one, I think, is definitely something that I haven't talked about yet and isn't usually my area of expertise, but the idea of solid fiscal management, that's part of your organizational capacity component. And if you are using attachments to demonstrate any sort of need or add supplemental material like a references page or something like that, just be careful that all of those are formatted in the exact same way and that they are following all the rules of the notice of funding opportunity or the request for proposals. And all successful grant applications, in my opinion, have that review process prior to submission. They go back to the team lead who kind of got everybody together in the first place, and the team lead may or may not be actively participating in the writing process. Sometimes it's even better if they're not necessarily super involved with the words on the page, because they can be a sort of impartial reviewer and they can check everything against the NOFO or the RFP and make sure it's all there. And then finally, all successful grant applications, and this might seem self-evident, but you need to submit everything at the same time. Unless there's some sort of staggered deadline for sometimes private foundations have like a 2-step or 3-step application process. everything should be submitted at once. Next slide, please. Next slide. We've already talked about a lot of this. So we are, I wanted to make sure that we had time for questions, and looks like we've got about 8 minutes here. So I just wanted to include both my email addresses there. One of mine is the IRHA email address, and the other one is the standard UMTRC email address, where I get all the technical assistance requests as well. So any questions about our process or the writing itself, the review?
All right, as you're thinking about your questions, I want to thank you, Luke. You are the brains behind a lot of our grants here at the Indiana Rural Health Association, and an excellent grant writer. So while we are using the rest of our time for Q&A, I'm going to ask Carolyn to go ahead and pop the survey into the chat, and please, your feedback is very valuable to us as we send information back to our funder and reports, and also if there's anything that you want to see, any future trainings, webinars, virtual office hours, etc. All right, I'm going to stop sharing. And what questions do you all have for us?
And Becky's being modest because she's been part of a lot of successful grant applications as well. So she knows her way around a grant as well.
Yeah, but I don't have your insight into where to find the data. That's my weakness. We make a good team. So I will ask a question of you, Luke. You mentioned HRSA grants. Where do you find grants?
So grants.gov is probably your best resource for any kind of federal funding. And then I would say for any kind of state funding, you're going to probably be looking at your individual, but you're probably going to start with a Google search for your individual state. Every state kind of aggregates that a little bit differently, so I can't really speak to a great resource there. But for private foundations, that's also probably going to come from pretty much any major corporation is going to have a foundation of some sort. So chances are, if there's any kind of corporate funding out there that might be tangentially related to your organization, just look up that company's name plus foundation and see what they fund. The one notable exception being here in Indiana is Lilly Corporation does not fund healthcare related initiatives, despite being a pharmaceutical company. Just as a heads up there.
Yeah.
Let's see, looks like we have a chat. Living in Alaska, pediatrician living in Alaska with a private practice, and I'm in the process of looking for nonprofit to partner with to apply for the emergency rural healthcare grant. And this is my first grant application. Any advice other than what you've already discussed? Let's see. I think making sure that needs assessment is really like down pat is probably the first priority of any grant application, followed by making sure that you have a work plan in table format that's already like sort of conceptually like resolved before people start jumping into all kinds of other parts of the narrative. Being able to have all of those inputs, outcome measures, process measures, even a logic model if you're so inclined. I'm not a logic model person, but I know a lot of people are. Having a work plan on paper before you start writing the rest of the narrative, and then in conjunction with the needs assessment and making sure those two things are aligned, I think is probably key to a successful application, especially one of that magnitude.
Mm-hmm. Yeah, as far as partners, yes, absolutely. A tribal community, if you've got one in the service area, would make a good partner. I was going to mention the State Department of Health or the State Office of Rural Health. I know the Technology Telehealth Resource Center, and I'll put their, actually I'll put the national map up of all of the telehealth resource centers. But if you go to the National Technology Assistance and Resource Center, we call them TTAC, they're out of Anchorage, Alaska, and they're just like for us, our employer is the Indiana Rural Health Association. Their employer is the Alaska Native Tribal Council. And so they might be able to assist with either partners or might be interested in being a partner with you.
Yeah, another good point there from Andy. Federally qualified health centers in your area would be a good resource as well, especially in a rural community.
Yeah. And anybody looking for partners, I'm going to go ahead and share my screen one more time here. So this is our national website, the National Consortium of Telehealth Resource Centers. And if you, I got to get to the map. We've changed it here. You can see an overview of who we are and what we do here. But by looking through this list by state, you can see which telehealth resource center at the regional level covers your state. And that's always a good place to start for information and connection with other programs. Here's our policy center and the National Technology Center I was just mentioning. And by clicking on any of these, you can go and explore their specific websites. Here's the more information about TTAC, and Doris is the director, so you could email her right there. Yeah, Medicaid managed care organizations, those would be, Andy, you are awesome. A lot of good feedback there.
Yeah, and having those partnerships identified ahead of time is key. The last thing you want is to have a completed grant application and be waiting on memoranda of understanding or letters of support at the last minute to see if anybody's actually willing to work with you.
Mm-hmm. Yep, absolutely. All right. Any last minute questions as we end our time today? All right. Well, thanks again, Luke, and thank you all for joining us. Have a great weekend.